So once we have IT infrastructure, meaning to say that we have computer and we have information technology, um, and the internet, right? We are open to more technologies that can help us in our day-to-day lives, right? For example, we can have the concept of telemedicine and telehealth, right? Telemedicine is the usage of IT infrastructure to perform a medical operation, meaning to say that maybe you are to perform a surgery or some kind of medical procedure. It can be minor or it can be as major as a surgery, and you actually consult an expert, a medical expert, another doctor on how to do it, right? Because you might not know how to do it, or because you might not have the qualifications to do it. It's like providing health care, for example, to the elderly or people who are in the rural areas, right? In which it is much harder for them to drive to a certain medical institution or a certain medical center compared to just being at home and have people taking care of them, right? So in this particular case, what happens is that there will be some kind of a monitor and a lot of correspondence in terms of verbal correspondence as well as maybe even visual correspondence. So we will have the doctor talking to a nurse or maybe another doctor, another junior doctor, right, who's going to perform the medical procedure on the patient, right? So that is telemedicine. Telehealth, on the other hand, also takes into consideration the preventive side of medicine, meaning to say that you can take into consideration, for example, some kind of encyclopedia for medicine and a regular diagnosis of patients. Meaning, it's like, for example, the elderly, they should go for health check rather often, maybe 6 months, once every 6 months, or 3 months, or maybe even 2 months, right? And again, or people in the rural area, maybe they have to do that as well because of maybe lack of clean water or other different conditions that they're subjected to, right? So it's a good idea for them to have regular medical checkups, in which case they can prevent themselves from getting sick. Again, we can use information technology to help with this, meaning we can have a qualified nurse or doctor, right? Maybe not an expert, but that's okay. Basically, they can help prevent diseases, help prevent these people, the elderly or people in rural area, from getting sick, meaning the preventive side of medicine, and that is telehealth. Now, there's another tele which is very interesting, and it's not really with regards to healthcare. This is just with regards to employment, right? And it's quite, how do I say, in especially in developed countries, it's quite popular, and especially in IT, we call it telecommuting. You see, one of the main concerns for people wanting to get jobs would be location, right? Is it ideal? Is where I live ideal to where I work? And especially so for people who have gained quite a lot in their careers, meaning to say that once you're very good, once you're a top talent and you know it, you know that you'll be able to get work anywhere, right? So this poses a little bit of problem and dilemma, meaning to say that you're a good talent and you're happy at where you're working, but because you're shifting your home, for example, so you would like to shift your job as well. So instead of shifting your job, right, your boss might be able to offer telecommuting. What is that? That is where you don't have to actually go to work at your workplace, meaning you can actually work from home. Of course, this entails you to have certain infrastructure. For example, you might have to have a desk, a proper desk and computer, some kind of like a workstation kind of setting, meaning it's like you have a cubicle at home, and you will have to have some kind of a camera system, right? Might be a CCTV up there, or you might have to often be in front of your webcam, right? So again, I said this is a very, very desirable proposition. I mean, who wouldn't want to work at home, right? But of course, I don't think this benefit will be offered to everyone, right? Um, and when or if it's offered, there must be a reason behind it. For example, it's a top talent, and the company does not want the top talent to go elsewhere, to go to another company just because of location, right? or is a very well disciplined person. So there are advantages and disadvantages of telecommuting, of course, right? Advantages are, like, for example, you don't have to go to work, meaning you save on money on petrol. You have meals at home cooked meals, right? Which is great, and you don't have to spend money on meals um, as much, because home cooked meals are generally more cost effective, right? Um, there's also the sense of, when once you're at home, you can do other things. You can take care of your children, right? So it's very desirable, and it's very advantageous. But then again, there are also disadvantages, right? Because first you have to be able to motivate yourself, meaning your employer have no power over whether or not you have motivation, right? Um, Second is, your employer again have no power whatsoever on what is happening at your location. Meaning to say, if you're working at home and your child continue crying and crying and crying, the employer has no control over this. They cannot do anything. Or people kept honking, or some car alarm or something. The employer, your boss, cannot do anything about it, right? And then there might also be a risk of you missing out on um, out of work things, for example, family days and etc. Right? You might be a little bit deprived with regards to social life. But anyway, don't you think that telecommuting is an interesting thing? I think it's a very interesting thing. I think it's very applicable. I mean, look at the jam that we have, the traffic jam that we have in Malaysia. Imagine if you have telecommuting. I'm so interested in this that I actually put the article for telecommuting for this week, meaning for week 11, right? So you might want to check it out. You might want to check out the article for week 11 is telecommuting, right? You read on it. I mean, it's like it's a little bit of a fun article in which, yeah, there's a little bit of funny in it, so it's a bit fun to me, at least, right? So do check it out, and that concludes week 11.